GERD, or gastroesophageal reflux disease, or acid reflux, is really common. So many people have acid reflux. Some people have more than others, and it really affects their quality of life. And there's a few things to remember about GERD. One is simple changes like diet changes and lifestyle modifications can really help the symptoms. Losing weight, changing the way you eat, what you're eating, those types of things. And there are over-the-counter medications and prescription medications that can also benefit if patients need those. But it's really key to understand that medical management for GERD, coupled with dietary and lifestyle modifications, is really the initial path for helping patients with GERD. If your GERD symptoms are getting worse, more persistent, they're affecting your quality of life, you can't do the activities you want to do, or you can't eat or drink what you want, and you're worried about it, it's really important you see a gastroenterologist and have an upper endoscopy. The gastroenterologist will help tailor therapy to the individual patient, to your symptoms, based on how you're presenting. Surgery is the most invasive approach to managing GERD because most patients will do better with dietary and lifestyle modifications, certain types of medications. And surgery is something that's irreversible. It may have complications, have side effects, it may not last, require repeat surgery, other therapies. But for certain patients with severe GERD, patients that don't respond to the medications that well, they can benefit from surgery, but really medical therapy is the first approach. The last thing I want to do is send my patients to surgery because surgery is life-changing. It's associated with potential complications, side effects, and it may not work over time. Some patients with chronic GERD develop a condition called Barrett's esophagus. Barrett's is a change in the distal esophagus lining related to injury from acid. It's asymptomatic generally, so if you have Barrett's, you usually don't know it. You're just having GERD symptoms or even mild symptoms. The challenge with Barrett's is that it's a precancerous condition. So in some patients with Barrett's, they will eventually develop esophageal adenocarcinoma, esophageal cancer. And so if you have long-standing GERD, it's important that you have an upper endoscopy at some point, specifically to screen for Barrett's esophagus as well as other complications. Traditionally, we perform biopsies of the Barrett's and have those samples examined by a pathologist to look for worrisome changes such as dysplasia. There's a new technique called Watts 3D, and we were the first practice in Colorado to use this technique. We use a brush to take samples, and blocks are made, and it's artificial intelligence. So AI is looking at these tissue samples and looking for dysplasia and cancer. It's a much more sensitive technique because it uses artificial intelligence to examine the cells. It's much more likely to detect worrisome findings such as dysplasia or precancerous changes or even small amounts of cancer. If we find dysplasia on the samples during endoscopy in the Barrett's, which means that there's precancerous transitions happening that could lead to cancer, we act on it. There's a technique called radiofrequency ablation, which is also an endoscopic technique performed by some of our specialized gastroenterologists that can ablate the Barrett's tissue, destroy the abnormal tissue, and therefore prevent the development of cancer.